Jan Lamont, Practice Manager. The way you access care is changing. We know the last few years have been difficult. There's a growing demand for appointments, but not a growing number of doctors available. Due to COVID, we've been doing a larger number of consultations over the phone, and this works well for some people and some medical problems, but not for others. We've continued to see people face to face throughout the pandemic, and now we need to see more people in this way. We know the wait on the phones has been longer than we would like, and due to the pandemic, our patients are more used to using computers in other areas of their lives. In order for us to work out who is the best person to deal with your problem, we have invested in a new triage system called Klink. This is used by other practices around the country, but has been customised by our team.
Hello, I'm Dr. Gareth Morris. Over the last 2 years, we've been working hard to secure additional premises for our growing population. The Iris Suite is a newly refurbished unit at Wisteria Court, in the rooms previously used by the Red Cross. The Iris Suite will house the team dealing with urgent cases and also have a small waiting room and 2 clinical rooms. The Iris Suite will be operational from 8 AM to 6:30 PM, Monday to Friday, but is not a walk-in service. The Wisteria and Milford surgeries will be open from 8:30 AM to 6 PM, Monday to Friday, and here we will be dealing mostly with non-urgent problems. Where possible, you will be offered an appointment with your registered GP, as we appreciate continuity of care is important to you and to our doctors. Our routine appointments will be increasing from 10 to 15 minutes, and you will be offered the choice of whether you want this face-to-face or by phone. Thank you.
Hello, I'm Rachel Plum, Team Leader. The new Klink system will enable you to submit requests for care via our website, replacing the e-consultation system we were previously using. The idea is that our requests for urgent and non-urgent issues goes through this new system. If you are not able to do this yourself at home, then we will have the ability for you to access the system in one of our privacy rooms, or one of the team can take you through the process over the phone. Our team have been training on the new system for some time, ready for the new launch. You can start your request as early as 6 AM and don't have to wait on the phone lines to open at 8:30 or wait in a queue to be answered.
Hi, my name's Dr. Neil Moody-Jones and I'm a GP partner based in Milford. The government has invested in additional roles working in primary care, which should help reduce the waiting time to see our doctors. For example, this might mean consulting a nurse practitioner or clinical pharmacist who can prescribe for certain conditions. It might mean being seen directly by a specialist physio, or getting support from a health coach or social prescriber. The idea is that by seeing someone else suitably qualified to deal with certain issues, the doctors will have more time to focus on those that need their attention. The Klink system means that we can prioritise care based on clinical need, rather than based on how early you start queuing on the phone. You can log in using your NHS login, like you might use for the NHS app, or if you do not have an NHS login, then you will need your NHS number. You can access this page via our website. By selecting the urgent option, your request will go to our on-the-day team. By selecting a non-urgent issue, you are more likely to get the clinician of your choosing. I would strongly recommend having an explore of the various tiles, which also cover other areas like nursing appointments, sick notes, and information on other services you can self-refer to. When you select urgent or non-urgent issue, you then select one of the 4 options which appears. Is it a musculoskeletal problem, a mental health problem, or something else you think can be dealt with over the phone, or do you think it needs a face-to-face appointment? The system will then ask you questions about your issue, and there are boxes where you can tell us more detail. When you submit your case, it goes through to our team to review and respond.
Depending on your request, you'll be contacted by a clinician to discuss your problem or by one of our admin team to arrange an appointment. It might be a doctor thinks you need a blood test or some other investigation before you see or speak to them. The system will evolve in time. We hope our new system will make it easier for you to access the care you need.